Depression, in some cases, can be associated with episodes of partial or complete loss of contact with reality, including delusions, hallucinations, and other similar symptoms. It's important to understand that we're actually dealing with a set of clinical conditions that can have very diverse causes and origins. The term depression functions as a label that encompasses different types of psychiatric disorders, each with its own particularities, but which share similar symptoms and thus are often given the same name. Doctor, what are the main factors? Is there a hereditary tendency for certain types of depression? In other words, are children of people who suffer from the illness more likely to also develop it? There are several studies and research that point in this direction, but we know that depression is not solely related to genetic inheritance. For example, some types of depression that affect women at certain stages of life can be triggered by hormonal changes. There are also so-called stressful events, which are significant events in a person's life and can trigger the onset of illness, such as a significant loss, separation, unemployment, bereavement, situations of violence, sexual abuse, prejudice, or extreme social vulnerability. Furthermore, the use of drugs, alcohol, or other substances, as well as certain diseases such as hypothyroidism, can also contribute to the development of depression, especially in people who already have a genetic predisposition. Therefore, depression usually results from a combination of multiple factors, rather than a single isolated cause.